So PRF stands for Platelette Rich Fibrin, and you do a blood draw on the patient. When we talk about technologies and the new technologies, we have to say this is one of those, even though it's not particularly a technology, it's a treatment, but it's really an amazing way to be able to draw blood from the patient and use the elements that are already in our blood in bone grafting techniques, and to be able to do what's called tissue regeneration. We're basically going to be growing tissue. And if we can use the patient's tissue to help them grow tissue, that's a lot more positive than it is to bring in artificial or, for example, cadaver bone, that kind of a thing. And so PRF is a technique that was developed by a medical doctor in France, and it allows us to be able to take the growth factors from the blood and use those growth factors to stimulate this tissue regeneration. And we see faster results, better results. We grow better bone, we grow better gum tissue, and it allows us to do so in such a way that's maybe a little less invasive to the patient as well. You know, in doing a blood draw, I mean, that just takes a few extra minutes. It really doesn't take any longer to do it, maybe extra 20-30 minutes in the overall process. Well, before PRF, we would just use what were trained in, which is to take either cadaver bone or bovine bone, and basically you graft that into an extraction site or where you're going to place an implant. And nothing wrong with that. It's just better with PRF.